So I will be talking about enrollment strategies. How many of you, how many of you are certified application counselors? Kind of a navigator. Great, awesome. So how many of you have hosted an enrollment event in your community? Okay, good, wonderful. So we'll talk about hosting an enrollment event and also partnering with communities or groups that maybe you might have not thought to partner with in the past, but through ACA, it may be a great opportunity to tap into that resource. So, capitalize on your strengths. Focus on what has worked so far for you as a CAC or a navigator in terms of hosting an enrollment event or phone baking or door to door or even posting flyers. So, what has worked for you so far? Focus on what you do well and build on that. So, if you have an event at or hosting an event at your community center and it's spectacular. You know, there's no reason why you should that should be your only event. Host another one the next week or the following week or every first of the month. Um, and leverage those relationships within your network and outside of your network. You know, try to find those entities to partner with to bring more faces, more opportunities for outreach and networking to your event or and to your education and outreach efforts. So, on capitalizing on your strengths, first identify what has worked. What has worked for you in your own community? Oftentimes, we all know that most tribal communities aren't all the same. The demographic isn't always all the same. Um, there may be more elders than there are young people, or the opposite, or maybe the socioeconomic climate is a little different. You know, we are all of our tribal communities are just a little different. Um, so identify what works within your community and what kind of what can be a success within your community in terms of enrollment events or other kind of enrollment strategies. So make plans to repeat these strategies. So you have, for example, Tinka from the Great Plains Tribal Chairman's Health Board, they had this great idea to print up some postcards about the Affordable Care Act and urging enrollment. I think there may have been a line about exemption on the postcard, but instead of just mailing it out to all of their members, they put it in the commod boxes. They put it in the WIC mail outs. They utilized different areas, different resources to get this information out. And, you know, a lot of our tribal communities have programs like this that we can partner with and also utilize to send out the information. When she told me she was putting these postcards in commod boxes, I was like, wow, that's pretty cool. I mean, everyone who gets, yeah, it is. It's brilliant. So everyone who gets a commod box is going to learn about ACA while they're eating their cheese. That's awesome. So as we all know, for members of federally recognized tribes, they have the special monthly enrollment status. So continue these awesome strategies that are already working for you, continue the plan that you have in place, build upon that plan, and amplify it for the next year, for the rest of this year in terms of enrollment. Seek out those folks that still haven't enrolled and are eligible for that monthly enrollment status that can enroll and amplify that plan for enrollment through the year. So one of our, as I mentioned, NCAI, NACUI, and NIHB are national partners of the NEHO initiative. And what we were asked to all take the CAC, the Certified Application Counselor training. And I think it was maybe like 20 hours of online coursework. Um, and we did. And just by doing all going out to Indian country and doing these trainings and talking with different people, either in person or over the phone or through webinars, we've learned that having certified application counselors within your community to assist your community members through the application process and be that resource to answer questions and to be on site and to be within the community is it speaks volumes. You are so valuable as a certified application counselor, as a navigator. You are an asset to your community, because you're able to help your members get through the enrollment process. So I'm not going to read this to you because I'm sure you will. I believe in you. You guys can read. So um, I encourage those folks of those of you who aren't CACs to look into becoming a CAC, or look into your tribe or your organization to become CAC certified. And uh, Dr. Rubidoux, she always, and Jeff gives this update a lot as well, that is at least one certified application counselor in every IHS operated facility. So I think at the last call we had, there was about 320 CACs out there at the IHS operated facilities. So that's awesome. If I, but they're only the only snag there is that there's so many folks coming into the facilities and wanting to get enrolled, and there's only one certified application counselor, and oftentimes to get one person enrolled, can take up to 4 hours, depending on how well the website is working. So this is really a testament to that. That there needs to be more CAC folks within the clinics, within the community, within the tribe, to help in that effort. Yes, sir. The CAC. Okay, the question was, are the certified application counselors the same as navigators? And they are not. They both assist folks through the application process, but I have a slide on that, so I'll get to that in just a minute. But real quickly, navigators are federally funded, so they are funded through CMS, through a navigator grant, and there are some tribal organizations that have a navigator grant, and there other organizations I think some states have navigator grants, right? And some states have navigator grants. Non-tribal organization have navigator grants. The certified application counselors, however, is a training still through CMS, but pretty much anyone can be a CAC, but they have to go through this 20-hour training. Um, and an organization can be a certified application counselor entity. Yeah, Felicia.
I don't mean to interrupt. So when the Indian Health Service did the application to become a designated organization, what they did was they did a national application, and so with that, we are not allowed. And I don't know, how it came about, but we are not allowed to post our CACs, if a organization IHS has a navigator. I know they don't in the state of Montana and Wyoming, but if they did, we can't be like published on a website. So like our CSI, our Commissioner for Security and Insurance, she has a list of all the navigators and the CACs in the state of Montana, but she don't have our tribal CACs listed. So I'm the one that has the list for that. But I'll share with you. You said you're from Rocky Boy. Is that where you're from? And you do have some navigators that are close to your region in Havre. So the Bullhook Clinic, they have navigators. But I'll leave this with you, and it gives a list of. And I have more copies if you guys want them.
Thank you for that, Felicia. Felicia, just so you all know, is the Affordable Care Act coordinator for the IHS Billings area and has been such a resource while we've been here in Billings. She along with some other CACs in the state, have helped us out at our ACA enrollment booth that we had out in the atrium. So thank you. Okay, let's move on. So become CAC certified. To become CAC certified, your organization must have a process in place to screen staff to make sure that they protect consumer information. We all know about HIPAA. We want to make sure that the consumer's information is kept secure, and that we respect the person's privacy. Um, and through the CAC training, there is a module on privacy and security, and it really details how what you should do and what you shouldn't do. You know, writing down PIN numbers, writing down social security numbers. Those are things that you shouldn't do. Um, Leaving your computer unattended while a person's personal information is up. Don't do that. Um, Okay, also engage in services that position you to help those serve with health coverage issues. Have experience providing social services to the community. So first, your organization must have some kind of privacy process in place, and then the organization should be that resource to assist people, and also to provide that kind of community engagement for folks. And for you all who are certified application counselors or navigators and are within your community, you are again, you are a complete asset. You know better than anyone else, any other entity, the needs of your tribal members, and you can relate to them on that, kind of one-on-one, rather than someone from the state or some other kind of organization coming in and that may be native or not, and trying to enroll your folks. So, if your organization is a healthcare provider, you must share with CMS what kind of healthcare you provide, and to what kind of populations you provide that. So, this is just something I picked up from the CMS website. So, if should you want your organization to be CAC certified, you have to tell them whether it, if you qualify, or if you fall into any one of these categories. So here you go, sir. This is assistance through the marketplace. This is a table that tells you on this side, state-based, state partnership, and federally facilitated marketplace, and on top, the kind of assisters that there are: navigators, non-navigators, certified application counselors, and agents and brokers. Um, so here in the SBM, the state-based marketplace, navigators and CACs are accepted. And non-navigators and agents and brokers, that's optional. So I'll let you take a look at this. Can you see it? Okay. Okay. And training and certification required for these folks. Um, State training and certification uh, required for pretty much across the board for the state-based marketplace, and federal training for the state partnership and the FFM. And we'll just take, you can look at that further. And if any of you have had if any of you have had experience with agents and brokers, they usually are from a provider like Blue Cross or Blue Shield, and they are hired by that insurer to go out and and assist you in that particular plan in that particular insurance company. Um, but that's not the case for navigators or CACs or non-navigator personnel. So, to the fun part, to host an enrollment event. So, why plan an enrollment event? It's an efficient tool to help maximize enrollment for our American Indian and Alaska Native population. And, it's really effective in the rural communities and in reservations or those communities that are near reservations. It jazzes people up and really want and it gets them excited about the Affordable Care Act, about enrolling when you have an enrollment fair or a health fair or host an enrollment event. We had an enrollment booth out here for this week, and we had some good traffic that came by. Some people that had um, really good questions, and I'm thankful to the folks that were manning the booth because they were able to answer those questions and assist folks in enrolling or finding out if they qualify for Medicaid. So these are some really awesome opportunities for those of the American Indians and Alaska Native population that isn't currently covered. Also, having hosting an enrollment event creates earned media possibilities. We you could I'll talk about promoting the event in a little bit, but to host an event on in your tribal community, um, maybe your tribal newspaper or radio or other kind of media will cover it. That's great. That's awesome. You want to get that word out, and plus it's just a really good opportunity to bring the community together and educate them. And it's a good opportunity to have volunteers and to share the knowledge. So, how to set up an enrollment event? First, identify your target audience. For us as American Indians, Alaska Natives, we have some different groups of consumers. We have the individual consumers, we have families, young adults, elders, employers, and as I mentioned earlier, NIHB is tasked with reaching out to elders and young adults. Just a few weeks ago, my colleague Dawn and I were here in Billings at the same hotel for the American Indian Higher Education Consortium Conference, and we did a training similar to this, but a more condensed version for the students, for the conference attendees, which were young adults and students and faculty, and they had a lot of great questions. And we also had an enrollment booth there, and Felicia and Tinka from Great Plains Tribal Chairman's Health Board were there manning the booth, and a lot of young folks were coming by to see if they even qualified for a health plan or for Medicaid. Um, your first step is to identify your target audience. Step two, build your event team. Find trusted partners, institutions, locations, and I've just listed a few here. These could be your partners or your locations, tribal community centers, chapter houses. I'm Navajo, so I always put chapter houses in here. We don't have community centers, we have chapter houses. Tribal colleges and universities, and I'll get to TCUs in a little bit about how to partner with them. Even libraries. Libraries and tribal colleges are a really great place to hold an enrollment event because they have computer labs and they have that space. They have, Wi-Fi or internet hookup, so you don't have to haul around some portable printer or laptops like we were doing the other day. But they have those kinds of resources like a computer lab, and you can enroll several folks at or assist several folks at the same time. Um, as NIHB is a NEHO partner, so we serve as a resource to you. So yes, we are your partner. Look to us if you need any kind of materials or promo materials. We'll be more than happy to send stuff out to you. If it's not in a hard copy, then we'll send you a link or something of that nature. Yes. A lot of our brochures that we are in the midst of creating some brochures, and they can easily be customizable. Um, it's like created in Publisher. If we send you that Publisher file, you can change it, tweak it a little bit so it's specific to your community. Yeah, and I believe NCAI has some materials like that as well. Right, right. In both NCAI and NIHB are working together to develop those kinds of materials on exemption and other information that individual consumers need to know about. Okay, step three, set a location and a date for your event. Again, in the list in the previous slide, community centers, chapter houses, libraries, tribal colleges are great locations to set up an event. As I mentioned, libraries and tribal colleges have the computer lab and free food and giveaways. We all know that that attracts a lot of people. If you want to have a Navajo taco sale, I'm sorry, an Indian taco sale. Navajo tacos? Yeah. Excuse me. I mean Indian taco. If you want to have an Indian taco sale, then that's awesome. You know, free food or provide free food, have a potluck or something like that. Just bring the community together. As Indian people, we always gather for food, so that's a great way to bring folks together. And giveaways are also nice too. And in planning your enrollment event, it's best to pick the date and then work backward about 3 or so weeks in terms of planning. That will really, really help you. So, step four, recruit the most appropriate assisters, navigators, CACs for your event. As when I asked if anyone here were navigators or CACs, I saw a few hands go up. So that's great. You know, if you have community organizers or folks like that in within your region, please hook up with them, be that resource for them, and help them to set up their enrollment event and be their CAC. As I mentioned, CACs are in all of the IHS facilities, IHS operated facilities. Some some tribal organizations have a navigator grant. I don't think there are any tribes that have a navigator grant. No, actually, the Ponca tribe of Nebraska. What okay. What tribe are you from again? Lummi. Great. So the Lummi tribe in Washington has a tribal in-person assister grant that can be utilized. That's awesome. Step five: promote your event and recruit consumers through tribal radio and newspaper ads, canvassing neighborhoods or tribal housing areas, posting flyers in the community, social media sites, phone banking, door knocking. Uh, I got some of these ideas from another website that does a lot of through another organization that does a lot of this enrollment stuff. And so I'm not quite sure if phone banking or door knocking might be the best strategy for your tribal community. But definitely social media sites. Definitely hit that. Promote your event on Facebook, Twitter, and then during your event, take photos. Make your own hashtag, tweet it out, post your photos on Facebook and on Twitter. Get make people wish that they were there, and while they're looking at their Facebook, and then they say, "Oh yeah, I got to get down to that event. They have Indian tacos or whatever, and I can find out about my health insurance options while I'm there." So. Get the photos are a really great way to one tell the story, or to relay your message, which is let's get enrolled American Indians and Alaska Natives, but it's also a great way to entice people to come to your event. So, step three, have a successful event. And here's a photo. Here's a photo of Dennis from yesterday. Dennis from Lame Deers. He is a CAC, and he was helping a couple enroll in the marketplace. And this is our booth that was outside in the atrium. So next, I'll talk about partnering with tribal colleges and universities and other entities. So as I mentioned before, my colleague and I were here a couple of weeks ago for the AHEC conference, and we thought that this was a really good opportunity for us to do an ACA training and have set up an enrollment booth and reach out to that younger population. And I know that CMS has done some kind of focus groups and research on this, and that a lot of single mothers and young men are uninsured, and that they're a good target, a good consumer target to reach out to. So we thought that the AHEC was a great opportunity to get the education out there and try to get folks enrolled. So of the demographic makeup of the tribal colleges and universities is a little different from, say, other colleges. There are very low income students that are living purely on scholarships, non-traditional students that may be older, and they don't have any job-based insurance, and students that who who aren't on their parents' insurance because maybe their parents don't have insurance. And I don't think that any TCU offers a student health plan. And most are on reservations or near reservations, so that community outreach is present. Um, Felicia, could I ask you to come up here real quick? Felicia was at the AHEC booth, so she can tell you a little bit about what her experience at the AHEC booth was. I know I talked with Tinka a little bit, and her experience was that a lot of the young people just had no income, and it was hard to place them in any kind of category.
Yeah, that's right. So when we were at AHEC, that's what we were finding was a lot of the individuals fell below. And for the states that didn't expand Medicaid, those are the people that fall within that gap under the 100% of federal poverty. But what we also found out was when we did our outreach and enrollment at the local tribal community colleges, we were able to find additional individuals that were eligible for alternate resources, some kind of alternate resource. So we did collaborate with the colleges when we did our outreach and enrollment activities in the communities. You want me to? And then I was taking notes while April was talking, and I just wanted to touch up a little bit about like in the state of Montana. What we did was we gave our tribe in our urban program some money to do outreach and enrollment events. And that money, it's not used to buy food, but like April said, that's what draws people in. So we would collaborate with the tribe, the organizations that are able to buy food, and we would, a lot of our community events, that's what drew the people in. And we had them in the evening. Some we found out that it wasn't, beneficial to have them in the evening, that it was more beneficial to have them in the afternoon. So when we went back out, we knew when to schedule our presentations. And like April said, the National Indian Health Board is there for you guys. And also I'm here as well. for the state of Montana and Wyoming. And another thing is CACs, when you do the training, or when you have the training and you're helping individuals enroll, that we need to remember that we are unbiased, and we cannot encourage them to go towards one plan or the other plan, or one insurance company or the other insurance company. And I just thought that was really important to mention. And then also the navigators, the one difference, big difference, is that navigators actually go through a background investigation. So that was another thing I wanted to say. And then, like April said again, she mentioned, that food brought in a lot of people. But what we had at some of our events was also door prizes, and that seemed to draw a lot of people in too. I think one of our events, somebody had an iPad. So,
Thanks, Tinka. Oh, sorry. Felicia.
I called you Tinka too.
Geraldine, see, you should have brought Tinka. Let her know that she's missed. We're channeling her. So, setting up an event at a TCU, you will want to contact some folks to gain permission to have an event there. So, administration, first of all, either the dean or director of student activities, or faculty, for relevant classes like social sciences or health, classes in health, to spark that interest, to get some volunteers. Um, Also, you can contact student life coordinators or the student leadership to get some more involvement. So, engaging faith based communities, that's another entity in which you can get some support from. First, they're trusted messengers, and working with a local congregation to reach individuals and families in tribal areas can be an effective way to kind of break down those myths or those stigmas against or that surround the Affordable Care Act. Having having a preacher or someone who is trusted may help deliver that message, that ACA is beneficial for the American Indian and Alaska Native population. So that's just a suggestion if you want to reach out to that community. This is something that I've learned that a lot of folks in rural communities are doing. They're connecting with faith based communities to conduct healthcare from the pulpit tabling event, or an heal the community, or you can heal the tribe health outreach ministry, or you can host a tribal health coverage enrollment summit through a church or other faith based entity. Before I end, I want to talk about what we're doing with our elder outreach and education. Reaching out to elders is also a great way to get folks involved in your enrollment activities. They can be really good volunteers. They definitely can be influencers of the community. They More times than not, tribal leaders and heads of families will listen to the elders. And if the elders say, Shiyaja, grandson, granddaughter, it's really important that you learn about your options about health insurance coverage. Um, I enrolled in Medicare, or I am using Medicare to get my services, and remember when I got my hip replaced, or etc. Elders can really be that influence of decision making, and they're a great resource anyway. So we have here, you'll see an ACA activity placemat, and it gives 5 fast facts about Medicare, and I'll get into that just a little bit. On the flip side of this placemat, I wish I had a picture of it, but on the flip side of this placemat is this really cool word search, and it's all ACA phrases. If you're interested in either of these materials, the bingo game, that's all ACA phrases, and the placemat, we have them available at NCAI. We can send it out to you. You can use that in your own community to educate your elders on ACA. Okay, so before I get into the next slide, I had mentioned earlier that we did a PSA specifically for American Indian and Alaska Native elders, and how the Affordable Care Act strengthens Medicare. So we went to the National Congress of American Indians annual conference in Tulsa last year and did some discussion groups with some elders about ACA and asked them what is really important to them in terms of healthcare. What are the messages that they would tell their children or their grandchildren? We got a lot of great responses, and um, we we also asked them um, to list the five fast facts of improvement to Medicare, and we recorded that and put that into a 60-minute, or I'm sorry, 60-second PSA, and this is the outcome.
Under the Affordable Care Act, Native American elders need to know they will not be denied coverage for pre-existing health conditions.
Under the Affordable Care Act, American Indian and Alaska Native elders need to know that long-term health care will be affordable.
Under the Affordable Care Act, American Indian and Alaska Native elders will receive free annual wellness checkups.
Under the Affordable Care Act, American Indians and Alaska Native elders will have new protections against elder abuse, neglect, and financial misuse.
Under the Affordable Care Act, American Indians and Alaska Natives will get improved Medicare prescription drug coverage.
So pretty cool, huh? Did you see some familiar faces there? Yeah, we managed to round up some five pretty prominent leaders in Indian country to be a part of this great video. So we are very thankful to them, and we're actually going to use this their faces and that brand as for our other elder outreach and education materials. So in the coming weeks, you'll see posters. You'll see Frank's face with, his five fast fact. You'll see Cecilia's face with her five fact. So look out for that, and the video will be sent out to ITUs to play in their waiting rooms. We'll also send it out to senior centers, chapter houses, assisted living, and nursing homes to show to be available. And you can always contact me if you want a copy. We'll send some out to the area Indian Health Board, so you'll have that available. But it really, again, it is a resource for you all. Okay, now back to the PowerPoint. Oops. To go through everything again. So, just so you all know that this PowerPoint, along with Kitty's PowerPoint from this morning, they'll all be available on the NIHB website, likely on Monday. I know that some folks wanted Kitty's PowerPoint, so they'll definitely be up on our website on Monday. So I have like maybe 3 more slides, so just please bear with me. So what can you do to increase American Indian and Alaska Native enrollment? Reach. Convene your stakeholders or connect with an existing group, whether that's That's supposed to be IHS. IHS, National Regional Indian Organization, or the Area Indian Health Board. Those are all fine resources for y'all to reach out to and partner with. Define your metrics. Who are you reaching out to? What kind of demographic? And what do you expect to gain from whatever event that you have? How many people are you signing up? How many people attended your event? How did they find out about your event? Um, I mentioned this before. Develop a plan to get to your target audience. Where if whichever it is, individuals, families, elders, young adults, employers, etc. And enroll. Align your shared resources with your frontline staff, whether it's CACs, IHS staff, navigators, and position them in the community. And I know that you all are probably already doing that now, and that's awesome. So, capitalize on your strengths, as I said in the beginning, and use the power of the stakeholder group to broadcast a shared message. I did a media outreach and messaging session on Monday, and one of my points was that you want to have, in order to for your message to be effective, you want to have a good spokesperson for your message. So whether that is your tribal leader or your health director or your area Indian board chairperson or a director, whoever is that spokesperson, at that to relay that message, and it's really important. And also coordinate. Again, have a plan in place. We in doing this outreach and education for Affordable Care Act, and I'm sure the CACs and the navigators and Felicia, who has gone out into the community, we all know that there are some gaps in information out there, and some populations aren't being reached, and so we need to fill those gaps. And folks like Laura and I from the on the national scale are trying to identify where those gaps are, and want to partner with you, at the regional and local grassroots level to help fill those gaps and get folks in the right information, and then encourage them to enroll. Also, celebrate your wins. We may have not had a lot of people at our enrollment booth, or we may not have signed up a lot of people over the week, but we did have a lot of people stop by. We had that presence. We gave out information, and they answered a lot of questions. So, to me, that's a win. So, celebrate the wins, small or big. And also develop an evaluation plan before you implement. And there's some of these things that I mentioned before, um, that in measuring your metrics, who you're reaching out to, how many folks that you've enrolled, how many folks have attended your event, and all of that can be compiled and used for future funding requests. Things to consider. How effective was your strategy? What are your outcomes I'll be measuring? I just mentioned that. And, here are some more questions to consider. How did consumers hear about your organization, phone number? And that's something that we have to keep in mind. Not a lot of folks on the res have access to the internet. So always put your phone number on everything. Even though you might get calls late at night, or someone might prank call you, just keep your still give out your phone number. All right, this is the end of the enrollment strategy section of today's presentation. Are there any questions?